Hi, I'm Michelle Krasoulis, and I'm president of the Foundations at Rochester Regional Health, and I'm here today for our Facebook Live session, joined by Dr. Dave Gill, who is the director of the Memory Center at Unity Hospital, Unity Health. So, Dr. Gill, thank you so much for being here with us today. I appreciate it.
I'm happy to. Thank you for having me.
As always, I want to invite the audience to ask questions. Feel free to type your question in the comments section, and I'll pause periodically and make sure we get them answered. So we're here to talk about the longest day. So I want to just start with, can you talk about the significance of the longest day and what it means?
The longest day is an event organized by the Alzheimer's Association. Started several years ago. The idea there is that caregiving for people with dementia is a tremendously difficult thing to do and very draining. Many people who haven't done it and don't know people who have done it don't realize how difficult it is. So it's really meant to draw attention to that. And of course, the point about June 21st is the longest daylight day of the year.
I know.
So highlighting how difficult it is 24 hours a day, 7 days a week.
They never get a break.
Correct.
Yeah.
And studies have shown one of the hardest things for any person to do in terms of the stress it involves in their life is caring for a person with dementia.
Yeah, I can only imagine.
So it's draining, and so it's not just to draw attention to it, but also to fundraise around that event.
Yeah, absolutely, and create probably some additional exposure to resources and things that people can do to support one another. So for the audience and for me, let's start with help us understand the difference between Alzheimer's and dementia.
So it's a good question, and we actually in the medical field really have not done a great job distinguishing between Alzheimer's disease and dementia. The term dementia really is a useless term. It's like going to the doctor with foot pain, and the doctor says, I diagnose you with foot pain. It's just a term for memory loss.
General.
Yes.
It's way too general.
And we try to make ourselves sound smart in medicine by making fancy terms, and that's really what dementia is.
Yeah.
There are hundreds of causes of dementia. By far the most common cause is Alzheimer's disease. So about 2/3 of people with memory loss as we age, so dementia, have Alzheimer's disease. So it's by far the most common cause, but not the only one.
Yeah.
And there are hundreds of other things that can cause it too. So it's important to think about Alzheimer's disease being one cause, but there are many other things for us to try to figure out if it is.
Yeah, and I want to talk about that in a couple minutes. So is the medical community moving away from using dementia as sort of a catch-all and talking about memory care?
There's a lot of different movements afoot when it comes to memory care in the term dementia. We're actually trying to get away probably from even requiring cognitive impairment to make a diagnosis of Alzheimer's disease eventually. So much like cancer, someone can be found to have a lung nodule that turns out to be cancer but have no symptoms. We're trying to find a way to define Alzheimer's disease by tests in how to prevent developing memory loss. So that's sort of the big next step. But there are very mild forms of memory loss too, like mild cognitive impairment and things like that affect people's lives that they can come see us for that are not actually Alzheimer's disease.
Yeah, and I know it's, well, we'll talk about that in a second actually. I want to ask you a question so that I don't lose sight of this, but this is really becoming in some ways a global epidemic. From the stats that I've seen, 47 million people suffer from, I don't want to say dementia, but some sort of cognitive impairment, right?
And many times we say Alzheimer's disease and related dementias to make it easier. So yes, so many people, it is. And the projections are that that'll increase by 4 or 5-fold over the next 20 to 30 years as the baby boomers come of age, and there's a big population growth for people over the age of 65. So the challenges we're having now in the medical profession and for caregivers at home is really going to dramatically increase. And so we need to be prepared as best as we can to meet that need.
Is it, I'm curious too, is it that we've actually found better ways to diagnose it earlier, so those numbers are jumping as a result of earlier diagnosis? You know how sometimes with cancer rates it's kind of what you see, that sort of bump. Is that the case here, or is it really that there are actually more people just actually developing?
There are just more people, for the most part, more people over the age of 65. So there's going to be this big amount of people with the baby boomers. We are developing better ways of diagnosing it and probably diagnosing it earlier, so that is part of the issue. But the vast majority is that we're able to diagnose, or the people who are coming of age are just more of them.
Yeah, that's true. Let me pause for a second. Phil, any questions?
Take someone through like an initial diagnosis. What does that look like, and what does the initial appointment look like?
So if somebody comes to our memory center, they come and see either myself or Dr. Bruns, the two behavioral neurologists, for initial intake visit. And the majority of people will come back for a number of tests. They'll have lab work to look for things that are really easy fixes, so a low vitamin B12 level. They'll have an MRI or other brain scan to look for a stroke or things like that. And then they come back for a combined visit with one of our neuropsychologists and us, where they have in-depth memory testing, and then we meet as a group and we discuss what the findings are, and then come in and tell the patient what we think is going on.
It must be one of the more difficult things. I mean, it is such a puzzle, I think, in terms of you can't necessarily, I'm sure there's some things you can see on an image or in a CAT scan, but it's not as easy as diagnosing something that I could look at you and see, right? Because
it is very difficult, but in particular, we don't have easy tests. So it's this long process, and I hear that frequently from patients. Why is it taking so long to make a diagnosis?
I've heard that too.
And right now, it's not like diabetes where there's one blood test and you can do it quickly. It's a process where you have to go through multiple visits, have some tests, and then it takes several months sometimes to go through all that.
Yeah. So one of the things we always like to do in these is talk about risk factors, because I think for people listening, there's always this, okay, what should I be paying attention to? So what are some of the risk factors for developing Alzheimer's that people should be aware of?
Well, age is by far the strongest risk factor.
Yeah.
So those of us lucky enough to reach the age of 90, over half of us will have Alzheimer's disease or the beginning of it. So
really? Say that again.
So it really increases dramatically with age. So the rates of Alzheimer's disease go up dramatically over the age of 65. And as you reach your 90s, the rates are probably over 50% of us will have Alzheimer's disease or the beginning of it, which has led some people to think that if we all lived long enough, all of us would have it. The argument against that is there are some people who've passed away in their teens and 20s, come to autopsy and have no signs of Alzheimer's disease. So we don't really know, but really age is a very strong risk factor.
Yeah, of course.
In addition to that, anything that causes heart disease is a risk factor for Alzheimer's disease. So there probably is some connection. And we often see a lot of hardening the arteries of the brain on the brain scan when we diagnose somebody with Alzheimer's disease.
So it's blood flow.
Yep, so high blood pressure, high cholesterol, diabetes in midlife increase our risk in late life of Alzheimer's disease.
Did not know that.
Meaning in our 40s and 50s and 60s, we should have those things treated as aggressively as possible to try to reduce our risk of having Alzheimer's disease in our 70s, 80s, and 90s.
Okay. So, and this might be a difficult question to answer, but I want to ask it anyways. One of the things that we also try to do is say, okay, so what do you look for and when do you know you need to call and go see a specialist? Because I think that's the thing that people worry about. I always hear people say, I've lost my keys and maybe I'm having dementia issues, and I've always been told, no, it's if you look at your keys and you don't remember what they're for, right? There's the distinction.
Right.
But what should people know or be aware of?
Well,
either themselves or somebody that they care for.
Right. It's we not just worry about ourselves, but worry about our loved ones. And of course, that leads to a lot of confrontation sometimes, and that can be difficult.
I can imagine.
When I give talks about this, I always will say, how many of you in the audience have lost their car in a parking lot? And everybody, including myself, raise our hand.
I raise my hand.
And that's not the issue. The issue is if you lose your car in a parking lot and can't find it, you have to call somebody to help you. Because we all become somewhat forgetful as we age, especially as we have a lot going on as adults. Yeah. Our minds are focused on something else. We're thinking about what are our kids doing right now, what about other things we have to do, and that makes us easily distractible. Yeah. And that happens commonly as we age. So those types of things are not too concerning. So the normal things that happen as we age are the tip of the tongue phenomenon. Can't think of the word. It takes us longer to recall something. Yeah. We can sometimes misplace things. It takes us longer to learn things. Where the grandkid buys their grandparent an iPad and they say, "Granddad, why does it take you so long to learn the iPad?" That's normal. Yeah. But if you can't ever figure it out, you can't find your car in the parking lot, you miss appointments that are important, those are all red flags. Okay. And that should lead to a discussion with their primary care provider.
Yeah. Minor technical difficulties, but we're back. For those who have checked in since we originally signed on, I'm Michelle Grzoulis, and I'm president of the Foundations at Rochester Regional Health. I'm joined today by Dr. Dave Gill, who is the director of the Memory Center at Unity, and we're talking about the longest day in Alzheimer's. And I want to restate the question I just asked Dr. Gill before we lost our connection. So what are the concerning symptoms that somebody should pay attention to versus the I just can't remember where I put my keys?
Right, so good question. Yeah. And as we're talking, there are some things that are very normal as we age that we shouldn't get concerned about. Yeah. So taking longer to remember something, tip of the tongue, thinking of words, takes longer to do that, longer to learn something. The things that are red flags are when those really interfere with our overall function. So we can't ever learn how to use the iPad or the TV remote. We can't find our car in the parking lot. And we do things like miss appointments or forget to pay bills, things that are important, and we make a mistake with those.
Yeah, okay. Phil, I'm just going to check in with you real quick to see if there's any additional questions that have come in. Okay, so I want to talk about treatment. So let's talk about what's happening in the field, what are we focused on doing, what's Rochester Regional Health's approach to Alzheimer's treatment?
So that's a very broad question.
I know.
But it highlights some unhappy parts about treatment when it comes to Alzheimer's disease, which is there has not been a new medication in over 10 years.
Wow.
So we have older medications that help improve symptoms a little bit, don't slow down the process of Alzheimer's disease, and there hasn't been a positive research study in many years. So we have had some research projects here at Rochester Regional Health and collaborate with other ones in town. But the big challenge is what do we do right now for people that are diagnosed, knowing the medications have somewhat limited effect. And so we focus very heavily not just on using those medications, but how to reduce stress on caregivers and provide support for the patients and the families. And one thing we're trying to do is look across the system, how to provide that same support for people who may not come to the memory center. People probably don't need to come to the memory center to get access to those types of supports.
Okay.
And they can make such a big difference in the quality of life of the patients and the caregivers. And we work very closely with the Alzheimer's Association to provide some of this.
That's great. So I want to transition and talk about the caregiver, because I know that's not only the purpose of the longest day, it is to raise awareness around the stress, but for someone who has a family member who's recently diagnosed, who will be a caregiver, what are some of the resources that are available, and can you talk a little bit about the importance of talking about it?
Yeah, so the talking about it is a very important point, and it's always a difficult question for patients and families. Who do we tell? Is it okay to talk about it? And so we talk about that a lot, and it's up to the patient and their family, but oftentimes the families so much want to be involved and they want to know what's going on, and so talking to family is a very good thing. So we talk a bit about that. In terms of supports, within our clinic we have access to a social worker who can go do a home visit. We have many different educational programs, including a new one we started this year for people with dementia with Lewy bodies, which is a little bit different disorder. But many of those things are provided well by the Alzheimer's Association, so we have a very close connection with them, so that people have access to support groups, caregiver training programs, and all sorts of other activities. And it's very important for patients and caregivers to get involved in those. We know the more educated they are and the more they participate in those support groups, the less stress they have and the better well-being they feel as a caregiver.
I would assume that for folks who might not know how to access those resources, it's always great to reach out to your primary care as well, who should be able to connect. I always try to drive people back to that as well.
Absolutely. And that's one of our goals within the Memory Center, is to provide as much ability for the primary care providers to do this, so they don't have to send everybody to us if they think they can manage it in their own practice. Because really the provider that's best for that patient is the one that knows them best, has cared for them for many years.
And I would imagine that's what is difficult for people caring for someone with Alzheimer's, is that it's probably different on a day-to-day basis, right? So
the good day, bad day phenomenon is incredible. People will say, one day it looks like there are no problems, and they're called by their cousin from Sacramento.
They remember.
And the cousin says, I don't think they have Alzheimer's disease, because they're so good that day they call. And the next day they can't do anything, and they can't function at all. And so there's no doubt there's a dramatic change for some days versus others.
And I've heard from folks who I know who have had family members who have had Alzheimer's that there's also this sort of dual, I guess, challenge of dealing with being the caregiver, but then also emotionally dealing with the fact that you have this loss happening because this person that you've known might not know you any longer, or might not recognize you, or be angry, and I think that's very difficult, and people need to talk about that. The stress has got to be incredible.
It is. Being a caregiver is difficult in that scenario for many reasons, not just the stress of caregiving, which is tremendous, but you end up having many different things you grieve for, right? You don't lose somebody all of a sudden when they pass away. You lose them little by little, which of course is very sad, and you grieve for that, but then you also go through a different role, right? Instead of being the child, you end up being the caregiver and parent. Neither the parent nor the child wants that. I mean, the person with dementia and their daughter or son, neither person wants that role to change, and both don't like it.
But it's happening, and we want to support them.
And another thing that we have here and at the Alzheimer's Association are caregiver counselors to talk about that. Because that can be very difficult to go through, and there's people to talk to about those stresses.
So I want to ask you a question about becoming a physician, but before we do that, I want to kind of wrap up on this piece of it. So
really quickly, we did get a question. I know you're kind of talking about some of the free services, but can you touch on some of the free services in our community that people might be able to take advantage of?
Well, when it comes to free services for people with Alzheimer's disease and other dementias and their caregivers, there's really two main resources that everybody should look to, and they really work closely together. That's the Alzheimer's Association, and Lifespan, also sometimes Elder Sources, another term people will use for that larger group that people can access. but you should always start with them.
Okay.
And usually one phone call to the Alzheimer's Association, which in collaboration with Lifespan has a Caregiver Institute to provide support for that. And so one phone call gets you access to all of that.
That's great.
And so we're very lucky here in Rochester to have that whole system and to have us work very closely with them and be part of that.
And we are unique as a health system in having, I think, if I'm right, we're unique in that we've dedicated the resources we have to a memory center and building that
Absolutely.
capability out.
Right.
So I think we're clearly dedicated to ensuring that we support folks in our community with it.
Yeah, we're very grateful for support from the system.
Yeah.
Because not every system has that.
Yeah,
Right.
yeah. So, why did you become a doctor, first of all?
Good question. So when I finished college, I wasn't really sure what I wanted to do, but
No one is.
Yeah, but ultimately, the reason I became a doctor is my brother, who's 8 years younger than I did, had an ASD repair, which is a heart repair, when he was 2 and had a stroke at the time. And so he developed seizures because of that, and so I always wanted to be the person that he had as a neurologist.
Wow.
And I ended up wanting to go into pediatric neurology, but when I did my rotations in medical school, I found out that while I like neurology, I do not like sick kids.
Yeah.
It's very sad.
It's tough. It's
So
very, very
I
tough.
love learning about how the brain thinks and caring for people with those disorders, so that's my passion.
It's fascinating because I think the brain is, clearly the brain is incredibly complex, but to be really drawn to trying to understand it and then teach people about it is also really amazing. So
Yeah, it's very
we're
rewarding.
happy that you like to do it and have gone into it. So what are some final thoughts that you might want to share with our audience about the longest day, or anything that we would like them to know as we kind of wrap things up?
I think the keys are that we know how difficult this is and we recognize it, and that's why we mark this day.
Yeah.
That there's resources here, that we're here for you, and we collaborate with all the resources in the area, and it's all here to provide support for what is very difficult.
Yeah. Well, I appreciate the work that you do based on having had
Thank you.
people that have been impacted by this. And I know that the community obviously is benefiting greatly from the work that we're doing. So I want to thank everybody. Phil, any questions before I wrap up? So I want to thank everybody for joining us, most especially Dr. Gill. Thanks for being here. And for those of you who have additional questions, please send them in by way of the comment section and we'll get back to you. Thanks so much.